Bismillahirrahmanirrahim. My name is Dr. Shazad Wasim. I hope you all are doing well. Today we will be talking about ARMD, that is age-related macular degeneration. And as the name suggests, with the passage of time and aging, the changes occur in all over the body. And in eye, we have a classical example of development of cataract, which becomes opacified, but it causes reversible blindness. After cataract surgery, patient gains the uh, correct vision if there is no other pathology. But in case of age-related macular degeneration, patient may lose the vision permanently to an extent, and the treatment is also available to a to an extent. Not the total treatment of AMD has been uh, found till now, as it is not a disease, it is aging process. When I'm while I'm talking and my audience is the medical students, especially undergraduates, you need to understand and remember that there are basically, and in main majority of the books, the ARMD, which is also called AMD, is widely divided into two main types. Number one is dry type, number two is the wet type. What happens? It starts after the age of usually 60 years, but it may start a little bit earlier or it may start very late in some fortunate people. The patient starts complaining of distorted images or seeing the images smaller or larger, or there can be very vague complaints. We are not clear. There is no cataract, or even after cataract surgery and full refraction, patient is not being able to attain the best vision, that is 6 by 6. Then, when we examine the retina in age-related macular degeneration, the basic pathology in this disease is damage at the level of retinal pigment epithelium, and with aging uh, it starts degenerating. It is a degenerative process, as a result of which the part of the retinal pigment epithelium which is right below the macula, uh, that is affected, and macula is directly taking the sport, nerve supply, blood supply from the retinal pigment epithelium and chloride, and it is attached very closely like this with the neurosensory retina with the retinal pigment epithelium. And when something happens at the retinal pigment epithelium, this part, then this part, the neurosensory retina, is definitely affected. So, so as the name suggests, unfortunately, it affects the central part. That's why it is called age-related macular dystrophy or macular degeneration. So when retinal pigment epithelium becomes degenerated, then the patient comes to you with the symptoms of blurred vision, decreased vision, and so on and so on. In dry ARMD, you will see just distorted macula. There are many types. For example, in initial cases, you will see that the normal view or the normal appearance of the macula uh, goes away, and you cannot pinpoint that this is macula. Later on, there may be small lines which may appear on the macula, and in later stages, there may be a puckering occur, that is like this is a paper and we just uh, throw it away like doing this and in the dustbin, and then we again when we try to keep it out from the dustbin and flatten it, though it will become flattened, but there will be some areas of uh, which are not that clear. This is called puckering, like this one, and this puckering is something which is causing the patient to unable to see normally. In wet ARMD, there is exudation of serous fluid from choriocapillaries through degenerative retinal pigment epithelium to the macula. And in this case, you will find exudates on the macular area, and it is more dangerous and more symptomatic and more difficult to treat as compared to dry AMD. So, as the etiology is just the aging, we don't we can only delay the process. We give the patient a chart which is called ancillary grid, which is a scale chart and a dot in the center, and lines drawn all over the way. I wish I could let you people see how macular grid chart looks like, and I suggest that you Google it. We give the patient that macular grid and ask him if to see daily with one eye closed and then the other eye at the central point, and see if any of the peripheral lines or the central line or any area is distorted or becoming bad with the passage of time. This is the very uh, good subjective test, as the patient himself daily checks and comes to know that the VN is getting worse or it is static if treatment has been given. As far as treatment is concerned, with the advent of anti-VEGFs, they have a role, very good role in the treatment of ARMD. We give one injection initially, and after the prognosis we see, we may repeat the other uh, injections. And many patients get benefit from the uh, intravitreal uh, anti-VEGFs like bevacizumab, which comes with the name of Avastin or Lucentis, and especially the patients with wet ARMD in which there is exudation, these intravitreal injections are especially useful. And in dry eyes, they are partially uh, useful. Besides that, sometimes we opt for scattered laser uh, in the periphery of the retina in anticipation to, especially in wet AMD, to absorb uh, that constituents which have been released from the retina. So, if the VN is static, that's good. If it is deteriorating, we will keep on trying. And God forbid, if the stage is too uh, has gone too far, the disease, that the patient is near to blindness, God forbid, then we have to go for LVAs, that is low VA needs. Then send the patient to some low VA need department where he is prescribed by various types of devices like hand magnifiers, stand magnifiers, computer assisted devices, and many other things which can uh, pay, make the patient able to see or visualize the things in a magnified manner. So this is some introduction about age-related macular degeneration. Please write in the comments what do you think and what do you want to hear about eye disease. Hope to see you in the next video. Thank you very much.